On Your Side examines a mental health center in Portsmouth that was part of a Senate investigation. Harbor Point Behavioral Health Center was mentioned several times in a report on youth treatment centers entitled Warehouses of Neglect. Investigative reporter Chris Horn looks at the failures mentioned in that report through the eyes of a resident there. Chris?
Tom, we talked with Alyssa Hurdle and her mother, Rachel, who, by the way, is a chief operating officer for a mental health practice. Harbor Point is located about a mile from where I'm standing, but the Hurdles say it's a long way from where it needs to be.
Ready? Ooh.
This was the day that Alyssa Hurdle left behind Harbor Point Behavioral Health Center.
It didn't seem like they were super prepared. Alyssa had all of her stuff packed and ready to go, but we weren't able to get the records.
She spent 5 months here in Portsmouth, time that she and her mother say was damaged by a lack of communication.
We weren't told about her daily activities. We weren't told about what was going on.
A lack of attention to critical detail.
They were giving her or attempting to give her medication that was not hers.
And what they say was a violation of Alyssa's rights.
Denying outgoing calls is actually a violation of their human rights.
But even that pales in comparison to what this Senate report had to say about Harbor Point. Dragging or throwing of children. Rather than de-escalating a situation, a staffer hit the child. A staffer telling a child, "I will slap the S out of you, I don't care." Staff gave children incorrect and or mislabeled medications. We asked Senator Mark Warner what can be done.
I'm glad that you guys are staying on this, and we're going to stay on the governor as well to see what we can do in concert. These stories are horrific.
Harbor Point is run by Universal Health Services. The company declined an on-camera interview, but the CEO in Portsmouth responded in writing. Freddie Anderson stated, "Family involvement in patient care is critical to a patient's success. Therapy staff hold the necessary qualifications to treat and care for patients. Any medication error is promptly reported to the state. Harbor Point's compassionate clinical staff is committed to strong patient outcomes." But Rachel Hurdle says a staffer was, at best, vague about her qualifications.
Assured me that she was licensed. It was later on a piece of paper that I saw that her title was actually resident in counseling.
State regulators tell us in 2024 they got 19 reports of abuse, neglect, or rights violations from Harbor Point. Most involved peer-to-peer altercations. And the regulators say conditions have improved since August. That's when Alyssa entered Harbor Point. She says staff turnover was an ongoing problem.
It's like we just constantly had different staff, and it's like, who are you? Why are you here? If you can't handle working with kids who have issues, then you shouldn't work there at all.
But mother and daughter say even something as simple as more time outdoors would be a significant step forward.
The total amount of times that I've went outside since I've been there was like maybe 10, and I was there for 5 months.
And the fights among the residents don't surprise her mother.
Because when you treat them like prisoners, they're going to rage against the bars.
Universal Health Services has an extensive response to that Senate report. We have a link to it, the entire report and Universal's response as well, right now on wavy.com. Chris Horn, 10 on Your Side.